Hi, I'm Dr. Doug Ratner, who, along with my colleague Dr. Susan Walsh, wrote a book called The Wealth from Health Playbook that will help healthcare institutions and providers in their efforts to practice transform, especially after the COVID-19 pandemic. Okay, let's begin. The essential tenets of the Wealth from Health Playbook are the following. We must think out of the box. If healthcare is going to survive after this pandemic, we must be thinking innovative thoughts. And along those lines, we have the following templates, which we have shown to be very effective. Telemedicine. Telemedicine is something that I've been touting for years, and it is my feeling, along with many other experts, that the well over 50% of all office visits can be handled in this manner without any loss of personal contact. I find that it's very effective, a few minutes wait time for patients, very inexpensive, and will offload the office of visits that do not need to be, frankly, handled in that manner. We need to use artificial intelligence today to help us figure out where we are, where we're going, and where we've been. Very important. The Wealth from Health Rewards program I developed well over 3 decades ago, and it's had thousands of patients in it. We basically reward self management. And this is so critical for our patients and their families to learn how to self manage their chronic diseases. More on this later. The Community Health Trust was something we developed to help us usher in the era of social determinant for a community to help increase the level of participation by individuals and to level the playing ground. So we got together all the businesses in the area and had them offer discounted services for our individuals, and more on this later as well. We developed initiatives that got at exactly what people wanted. For example, pediatric asthma. We developed an environmental house call program where we went into the home and actually rooted out pollutants and helped families fight the asthmatic uh, disease in their homes, as well as a Race to Zero program to look at palliative care and to try to uh, make all the symptoms that people who are at the end of their lives experience basically drive them to zero. We have looked at the waste in the system, which many experts, including I, feel is equal to about $1 trillion per year of close to $4 trillion per year healthcare bill for the United States. Uh, the waste is felt to be from misuse, underuse, overuse, and diagnostic error. So we developed a high value care center to get at many of these issues and involve medical students as well. We developed a healthcare leadership and innovation curricula, all of which is described in the book, uh, to help medical students decide that they want to be leaders and how to innovate, how to create, how to think out of the box. Again, self management is key for our patients. We recognize the importance of precision medicine, but not all those genomic and metabolomic and all the other elements of it are ready for prime time. So we would utilize those targeted therapies that are presently demonstrable to help us tailor our healthcare diagnostic and therapeutic arms. We want to create new roles for healthcare providers. I mean, it's clear that there's tremendous burnout in the industry, and uh, we think this will help a great deal. We want to be scalable and reproducible so every community can participate in their own Wealth from Health playbook. And also, we want to wean everyone from thinking that the politicians, insurers, and the like will fix healthcare. This is not going to happen. I am convinced of that. We have to be pioneers in our own system. We want to eliminate variation in care, which is caused by a great deal of medical deficits of our doctors and nurses, etc. This, by no means, am I trying to um, point fingers at my colleagues, but it's well known that there is tremendous variation and not to the good. We want to understand how minorities who make up 40% of population are not receiving equal care. And I'm sorry to say this, but this is true. And I detail this in the book as well. Healthcare organizations need to expand their offerings if they want to stay in business. I suspect a great deal of, if not most, of healthcare organizations have lost considerable income by not being innovative. We want to be transformational, and I think that the playbook will show you how to be that way. We want 100% of medication adherence by a financial stewardship program, which we describe. We want to eliminate the silo mentality, which is prevalent in so many parts of medicine where surgery does their thing, OBGYN does their thing, and everyone seems to be in their own world and not uh, connecting at all through various means. We have been developing software called DocAssist.ai, which will help doctors in difficult diagnoses, either because they haven't seen various diagnoses or because they once learned it but have not seen it, and therefore it doesn't come to mind. It's very exciting. We want to decrease the $1 trillion waste, as mentioned. Uh, our community health trust did the following, and it's quite a list. We provided hunger relief, Meals on Wheels, mental illness relief. We helped enroll people in school, colleges, etc. We had helped patients with unemployment insurance, um, home issues, SSI, SSD, nutritional counseling. We addressed obesity, transportation issues, eviction avoidance, hearing aid and eyeglass vouchers, telephone programs, disability referrals, home care, housing, legal advice for people who suffered from family violence issues, dialysis referrals, subspecialty referrals. We help them secure their health insurance, medical equipment such as oxygen, help them with professional development, especially our sicklers, health literacy. We even went as far as to help them secure energy needs, smoking cessation, and senior daycare referrals. In essence, we helped increase access to care. We helped with the social determinants. We helped level the playing ground, pharmacy compliance, work presenteeism. We appeal to Republican and Democrats alike. This is not a political issue. And have ushered in a new era of practicing. You can expect to see significant healthcare dollar savings, which we achieved with $5 million savings with 4,000 patients enrolled. We've had reduce ER use, reduce asthma patient, pediatric asthma patient use. We've had reduced admissions and length of stay, medication adherence increases. Our social determinant community health trust has been a big success, and we've also reduced specialized services. Well, that's it. I think that you will find a tremendous amount of information in our book, The Wealth from Health Playbook. Um, and I look forward to talking to you at some time. Thank you.